Good morning, everyone, and welcome to our webinar for today on My Health Record for private hospitals and day surgeries. And we'll give you a bit of background, foundation information, key things you need to know, and talk you through the process for registering your hospital. So welcome, and to start off, I'd like to introduce myself. My name's Kathy Rainbird. I'm one of the managers in the education team here at the Digital Health Agency, and joining me today is my colleague Brianna, who will be talking through most of the presentation. We also have a couple of other agency team members here with us. Ashley Ramos is joining us to answer questions as needed. Ashley is currently acting the role as Director of Industry Engagement and Enablement, so working with a lot of the software vendors in their development of their products, but has also been working closely in the private hospital space previously, so is across many of the issues that you might encounter as you're looking to register your organisation. We also have Jess Ogilvie, who's part of our connection support team. So you may have already even spoken to Jess. She's guiding organisations through the whole registration process from the agency. And so there's a lot of support available to you and your organisation to help you through this process. But hopefully today, stepping through and outlining what's required will give you a good insight into what you need to know. So to kick off, of course, I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to elders both past and present. I'm speaking to you today from Menang Noongar country, part of the Bibbulum people's land, and I'd like to extend my respect to them and their elders, and also welcome any Aboriginal or Torres Strait Islander people who might be joining us for the session today. Just a little housekeeping to start off with. We are using the GoToWebinar platform. Hopefully some of you are already familiar with that. Your microphone is going to be muted throughout the presentation, but you can ask questions by typing into the question tab, which you can see here. You can also expand that tab by clicking on that little grey box on the side. That opens it up and makes it a bit easier to see what you're typing into that question pane. To collapse the GoToWebinar interface, you can click on this little orange arrow here and that pushes it to the side. And if your screen and sound don't match, you may have a bit of internet lag. We've been experiencing a bit of that this morning, so hopefully it won't interfere with the presentation today. But yeah, hopefully we can keep that going and on track. So in terms of our agenda for today, I will give a brief outline of some of the key foundations that work behind the scenes of digital health and underpin the My Health Record system. In particular, I'll be highlighting the digital health identifiers that work in the background of the system. Then I'll hand over to Bree, who will talk through the step-by-step instructions for registering your organisation and how you need to set that up. We'll go through some of the key considerations to take into account prior to registering, the steps involved in actually logging into PRODA and HPOS, all those acronyms will become clear, setting up your organisation, whether it's as a seed organisation or whether you need to add on networked organisations. And again, Bree will explain what that means in a moment. We'll also talk about the need for NASH certificates or CSP linking. Lots of acronyms, all will become clear, don't panic. Then we'll stop, we'll have time for some questions throughout that session, but then we'll take you through some further resources and training support. All of the agency team that we have online here are here to support your organisation through this process and also to support once you have got that connection with My Health Record in training up your team. Our education team can certainly help in that space. And then we'll stop and we'll have time for question and answers.
Kathy, sorry, just to jump in there, I think the screen is still paused on the first screen.
Oh my goodness, sorry about that.
I know you have a couple of
Let me just...
That's all good.
Just
before you jump into the juicy parts.
Thanks. So you've all missed out my full bit of the presentation there. Sorry about that. Now I just have to... Right, this somehow. I'm just going to turn off my webcam because I am getting a bit of internet lag at this end as well, so just hide that away. So the key thing, I guess, to start out with, we're assuming that you have a bit of an understanding of what My Health Record is, but just to give you a brief summary, the key thing is that it is a complementary source of information about the patients who may be coming into your healthcare organisation. So it gives your clinicians additional information that they may not have otherwise directly received. It doesn't replace your existing records, medical records, however they are stored or kept, but it gives that additional source of information. And it's really a summary of a person's key health information that's available nationwide. So it's being rolled out nationally and is a really useful way for clinicians to find key information that perhaps isn't held within your local hospital systems. There are two ways of accessing My Health Record, and that's what we have on this slide here. You can either do it through your software system if that has met the technical requirements to actually access and allow access to My Health Record. So some software has been through that process of technical conformance already, and we have a register of that conformity on our website, which is linked here. I'll also point out at this stage that you will get a copy of these slides, and all of these hyperlinks work, so you'll be able to get to this information later on. You don't need to write it all down now. We'll send you a PDF of the slides, and those links will take you directly to the bits that you need to find. So looking at that register of conformity, if your software product is listed there, that means that if you get registered and switch it on and get everything configured, then your clinicians will actually be able to see the information held in My Health Record directly through your clinical software. Some software hasn't been through that process, and we know that some hospitals aren't necessarily using a clinical digitised system yet. So there is the other option for viewing of My Health Record, which is through what's called a provider portal. So that gives you access without the need for software. So it's a free portal that can be used by clinicians to look and view a person's My Health Record. It is a view-only service, so it only allows the viewing of the information and not for uploading. So that's the other thing that hospitals can do, of course, is contribute information into the system, and we encourage you to do that because that helps improve continuity of care for patients. So with the software that's connected and able to, you can potentially upload discharge summaries or other relevant clinical documents such as outpatients letters or specialist letters. That can't be done through the National Provider Portal. So as I said, Provider Portal is view only. The software systems allow both viewing and uploading. Sorry, my slides just aren't progressing just yet. So as an overview of what organisations need to do to get set up to use the system, the key thing, one of the key things, is to actually get registered and connected. But before you do that even, there is a requirement to make sure that you have a security and access policy in place. So this hyperlink will it actually is a hyperlink here, which will take you to our webpage, which describes in detail the requirements for that policy. And there are policy templates, which Bree will show in a moment. The other thing, as I just said, what this webinar is all about is getting registered and getting connected to use the system. Once you've got those things in place, you do need to make sure your staff are trained and ensure that they're familiar with the policies that are in place and using the system appropriately. You need to confirm and have processes in place to authorise staff and how they will access and use the system. And you need to be aware of your ongoing organisation's participation obligations. And again, there's a web page which takes you to those details. But today we'll focus on that foundational piece of getting registered and getting connected. And to understand that, the key thing I need to highlight for you is the healthcare identifier numbers that work behind the scenes to make My Health Record ensure that the information is stored securely and accessed appropriately, and that the right information is identified with the right individual at the point of care. So there are a number of key identifiers that work behind the system, and that's highlighted on this slide. The first one on the left here that you can see is what's called the HPII, the Healthcare Provider Identifier for individuals. So that's for the clinician or person who provided the service. So that's for that individual person. So we call it the HPII or the HIPI number. The person who receives the service has an individual healthcare identifier as well. So that's the patient. So they have what's called an IHI number. And your organisation, the healthcare organisation that's providing that service and interacting with the system, has an identifier as well. So that's a healthcare provider identifier for the organisation, or HPIO number. So all of those numbers come into play when there's a healthcare event, and that information is then being transmitted to my health record to ensure that that's identifiable to your organisation, to the clinician who provided that care, and to the patient who received that care. So just to highlight those identifier numbers with a slightly different graphic and make it clear, as I said, we have the HPII, that's for the individual. That would be for either a nurse, the medical practitioner, a pharmacist, or a specialist. The HPIO is for the organisation, so that's for the hospital, the day surgery, the medical practice, or a pharmacy, for instance. And the patient has that individual healthcare identifier number. So the first step in getting set up and to use the system is that you have to obtain and register to get a healthcare provider identifier number for your organisation. And that's one of the steps that Bree will go through in a moment. So as an overview of what we'll talk through today and go into a lot more detail in just a moment, these are the key steps in registering your organisation. To actually do this process, you need to actually log in and have an authentication for yourself through what's called PRODA. Through PRODA, which is a bit like the healthcare provider version of MyGov, but it's for healthcare organisations or individual providers, you then can access what's called the Health Professional Online Services, which is how you interact with Services Australia. In that Health Professional Online Services, with the acronym is HPOS, then you can go through the process online of registering your organisation. And again, Bree's going to step you through that step by step of how to set up that PRODA account, how to get into HPOS, and then how to register your organisation. The first thing that Bree will talk about is what makes a seed organisation and what a network organisation is. So we'll talk through what those differences are. And the first thing to register is the seed organisation, which is the overarching legal entity for the business, and then add any registered network organisations if you have any. Once you've done those steps, you've got that HPIO number, then there are a number of different ways to access. So as I pointed out earlier, you can access through the provider portal or through a bespoke hospital system, which may mean that you need to have a technical setup of that system to be able to, for it to be able to talk to My Health Record. Or finally, through that conformant clinical software. If you're using either of the latter two of those, then part of that process is having a certificate in the background, a security certificate, which allows you to communicate and encrypt the information that's being sent and send it securely. And so that's where you need to request and download a NASH certificate or link your contracted service provider number with your organisation in HPOS. Once you've got that digital certificate, you've got the HPIO number, the final step is then configuring the software product, making sure all the users and so on are set up to use the system. So we will talk through that process in more detail. A lot of you may have already got that original HPIO number, so we'll go quite quickly through that, but we will cover it all and you will get the slides afterwards. So if we're going quite quickly, don't panic. You'll be able to follow through the steps later. But the main flow that we're going to focus on for today's session is that last one where we're talking about if you're using conformance software. So you'll need that PRODA account, HPOS, register and get that HPIO number, register your network organisations, then go through the steps required for having getting that NASH certificate, installing that, and then configuring your software. So I will now hand over to Bree, who will talk through how to register a healthcare provider organisation. Your hospital is the healthcare provider organisation for My Health Record and getting started. Bree, over to you.
Thanks so much, Kathy. So yeah, we will discuss a few things to consider prior to starting registration, because having these things sorted out before you initiate your registration process will really save you a lot of time and support you in best chances of faster approvals in HPOS and getting through the process a lot quicker. So as Kathy mentioned, there are roles and responsibilities in the HPOS system or with the Healthcare Identifier service. And it's really important that we get these right at the start of the process because this will determine who from your organisation is the right person to actually be initiating that registration with the HI service or with My Health Record. So here we can see the responsible officer, also known as the RO. This is usually the business owner or a CEO of the organisation, and it needs to be somebody that has authority to act on behalf of that healthcare organisation and ensure that its employees are compliant with the legislation. So this typically needs to be the person that is, or one of the people that is listed on the Australian Business Register associated with the business. And that is because this person needs to, have that legal authority to act on behalf of the organisation. So it's important to determine who the RO is at your organisation because they'll be the person that will be applying for the HPIO. Now, some of your organisations may already have applied for that HPIO or have registered with the HI service, and that might have been done with the person who was the RO at the time, maybe some time ago, and you might need to change who is listed as the RO in HPOS, and we will be providing resources later on in the presentation around how you can do that. But determining who is your current RO, if that one has already been listed in HPOS, or if you haven't got an RO already allocated in HPOS for your organisation, then working that out before you start is important. Now, the second role that exists in the HI service is the organisation maintenance officer, and we also refer to that as an OMO. This can be anybody in the organisation that is responsible for the day-to-day administration of the HI service. So this typically would be a safety and quality manager or informatics manager at the organisation, and it's a good idea for businesses to have multiple OMOs because this person can continue with the registration process once it has been initiated by the RO. So let's look at the policies that are required for connecting through to My Health Record. And this is really to ensure that before you get connected, your organisation will be complying with your participation obligations for using the system. So there is an excellent policy template that the agency has developed in collaboration with the Office of the Australian Information Commissioner. And it is available also on our website. We've placed a link in the slide here, as Kathy said we'll share this after the session. And the policy template gives you a useful guide as to what to include or think about how you're going to incorporate policies and procedures in your organisation to ensure that your organisation is complying with the legislation. So the template is great because a lot of the work is already done, and it's just about tailoring that template to ensure that it reflects what is relevant to your specific organisation. So it is imperative to highlight that the policy needs to be in place prior to registering for the system. Now, as Kathy mentioned, creating a structure in the HI service is an important part of the process and something that you want to get right from the beginning if possible. It is possible to change the structure if things do change. If a new organization is being added to your group, it is possible to change and add and tailor your structure, but it really does help to be aware of what the structure process looks like and how and work out what will be the best structure for your organization. So healthcare organizations can participate in My Health Record as either a seed organization only or as a network organization that is part of a wider network hierarchy. So we can see here in this example, you've got the seed organization. So when we say you're registering your seed organization, that is the overarching organization. And here we can see that's Alpha Health. And then we've got 3 network organizations below that. So here we've got Alpha Hospital Brisbane, Hospital Sydney, and Hospital Perth. And these are set up as network organizations that sit below the seed organization. So the first thing that you will need to do when registering, if you have or you require a network structure, is to work out what your structure will look like. And then first register your seed organization, because without your seed, you won't be able to add in your individual network organizations. Now, this is only relevant for some of you on the line. Some of you will only need to register as a seed only. You might not need to add any network organizations, but we'll give you some things to consider in the next slide around how you determine whether you should be a seed only or whether you should establish a network structure. So things to consider. How do you want to be known in the My Health Record system? So if you've only got a seed organization, but there are multiple departments within your organization that go by different trading names, that might be something to consider as to whether or not you add them as individual network organizations. Also, incident management and reporting and data management and reporting is important to keep in mind, because if you'd like to view data about how each of the sections within your organization are going with their My Health Record use, you will be able to do that by setting up those network organizations. However, if your entire organization is only set up as one entire seed, you won't be able to get a breakdown of data in regards to how people are using My Health Record. And that goes for incident management as well. If there is a potential data breach or any incidences with using My Health Record in your organization, it's important to be able to work out where that came from within the organization and report on that. So it's important to think about how your organization functions and what might work best for the way that healthcare providers in your organization interact with the My Health Record system. And the final consideration is access flags. So we'll talk about access flags in the next slide, but this will also help us to think about the access that we want to give clinicians to people's My Health Records, and whether or not that will help us work out when we need a network versus when we may just be happy to register as a single seed organization. Also important to point out here that every network organization has its own individual HPIO number. So that is why it is useful to have separate network organizations that sit under a seed, because we get that individual data for those HPIOs and we're able to better manage My Health Record within that specific department or sub-organization. But however, it is important that you work out what is best for your hospital and what will work for your clinicians, thinking about all of these things, and we recommend before starting the registration process, if your structure is established, it might be a great idea to get executive sign-off by sort of the management or executive levels in your organization, just to ensure that the structure is set up right from the beginning. Now, if you require support or assistance with developing a structure, if you're unsure what structure should be set up for your organization in HPOS, and you need some support with that, feel free to reach out to us. There is support, as Kathy mentioned, to assist you. help@digitalhealth.gov.au will get you through to our support team here. Now, access flags is a consideration for your structure, and that's because when you register any network organizations, you can set access flags. Now, access flags determine if network organizations can access the My Health record subject to patient controls. So what this means is if you've set an access flag for an organization, consumers can restrict access to their record by that specific organization. However, if you choose not to add an access flag to a network organization, then that means that an organization will have access to the health records that the parent organization has access to. So to better clarify that, because I know that that might be a little bit confusing, but essentially, for those of you who are aware, consumers can set access controls for their My Health record. They can choose to apply codes that they can provide to their healthcare providers of choice that will then grant them access to their own My Health records. They can choose to restrict access by specific organizations as well. So what this means is, as we can see in the example here, your organization might want to think about when it is appropriate for access controls to be shared amongst other network organizations, and when the consumer's personal choices with their access controls need to be contained to specific organizations within the structure. So in this example, we've got Alpha Health as the seed organization. We've got 3 day hospitals. And then we've got the Alpha Fertility Clinic. And as we can see, what we've done is we've applied an access flag to the fertility organization. Even though it functions in the same building as the other organizations, it is where we want to allow consumers to manage their access and not have that access propagate up into the rest of the seed network structure. So it is going to essentially put a bubble around that organization with the access flag. So any consumers that set access controls that affect Alpha Fertility will not affect any of the other organizations. And the same thing goes for the network organizations in regards to the day hospital departments. So the 3 day hospital departments, any consumer controls that are applied to each of those will also propagate to the rest of the network organizations and the seed organization in the structure. So again, if access flags is something that you're not confident with, or you want further support when it comes to understanding what your structure should look like, feel free to reach out to us and we can help guide you. So just to set expectations around how long the process takes, the RO will need to create a PRODA and a PRODA account and log in through HPOS, as Kathy mentioned. Once they've done that, it is about a 30-minute process to register the seed organization. So it's an application through HPOS platform that the RO needs to complete. It usually doesn't take any more than 30 minutes. It could be a lot quicker depending on how prepared you are to complete that application. And then the application is usually approved within 24 hours. Again, depending on how well the application was completed and the quality of documentation that was uploaded, if the HPOS system or Services Australia decides that they need further information, there may be some back and forth, and it can take up to 2 weeks. But in most cases, if the application was done correctly, then it will be about 24 hours, and then you've got your approval. Once you've got your HPIO number for the seed organisation, you can then add network organisations in HPOS. Now, this can be done by the OMO. It does not need to be the RO that completes the next steps. Once they've done the seed registration process and you've got that HPIO for the seed, the OMO can take over from there. Once the network organisations have been added in HPOS, then it is about a 15-minute process to request a NASH certificate once you've worked out how you're going to connect through to the system. So as Kathy mentioned, there is the option of either requesting and downloading a NASH certificate to establish that secure connection, or the CSP linking process. So you can do that if your software vendor allows you to do that in place of the NASH certificate. But either way, it will either only be about a 15-minute or 10-minute process to actually link the CSP and HPOS or download that NASH certificate. So those final connection steps don't take very long. And some of you on the line might be at this point where you've already got your HPIO and you just need to do those final connection steps. So we will absolutely cover those connection steps a bit later on in the presentation, so stay tuned for that. So I won't go into this into too much detail, but this is just going to give us a nice overview of the connection steps. So we can see PRODA and HPOS, as Kathy mentioned, will be the platform to allow us to register that seed organisation. Once we've done that and we've added any network organisations, then we see steps 3 and 4 will be those final connection steps. So we'll go through that throughout the presentation. So let's start with step 1, which is registering for PRODA.
Sorry, Bree, I'm just going to interrupt for a second because we have had a couple of questions just relating to that
Sure.
section where you were talking about the OMO and ROs and the seed network organisations. The first question is, does the OMO have to have an APRA number? So that's the Organisation Maintenance Officer. Bree?
Yeah, great question. Thanks, Kathy. So no, the OMO does not have to have an APRA number. It is typically somebody in the organisation who is actually not a clinician, because the OMO functions as an administrative support to the organisation in the HI system. So absolutely, we find that most cases the OMO is not a APRA registered clinician, and it can be anybody from the organisation. So what we'll do is we'll actually go through in this step how OMOs are nominated in the HI system, and you'll be able to see that it can be anyone from the organisation as long as they're appropriate for the OMO role.
And there's another, just more of a comment here from someone who's actually gone through a bit of the experience of having their RO set up, and they found that the CEO was unable to be the RO as they were not on ASIC as an officer for the organisation. They found that then that was a bit of an issue, but then that the OMO could be the CEO, CFO or equivalent. So I think in this next part of the presentation, Bree will go through the background documentation that's needed for the RO if they aren't listed as an officer for the business. There are other ways to have that person set up. So we'll cover that in the next section. There's a final, just a quick query here about if you don't have conformance software but are using the National Provider Portal, how do we upload information? Basically, the answer is you won't be able to. It's only able to be uploaded if you are using a software that is connected to the system. So the provider portal will only give you that viewing of information, and you can't upload through that way. So back to you, Bree, for the next part of the presentation. Thanks.
Thanks so much, Kathy. So what is PRODA? PRODA is an online two-factor authentication system, and it's used to securely access government online services. So as Kathy mentioned earlier, it's like the professional equivalent of the MyGov website. So you'll need to create a PRODA account to allow the HI service to identify that you are an authorized user. So the PRODA account creation process requires you to upload forms of ID so that you are an approved user, or the system can say, yes, we know who this person is, and then you gain access to a range of available services. As you can see from the right-hand side of the screen, there are a range of available services that healthcare organizations or people who work in healthcare organizations can access. But the one that is going to help us to register our organization and manage our organization's interaction with My Health Record will be HPOS. So what is HPOS? HPOS stands for Health Professional Online Services, and essentially it is the platform by which healthcare organisations can securely do business with Services Australia. So if you would like information about HPOS, please jump onto the Services Australia website, which will sort of give you a lot of detail around how to use and navigate HPOS, but we'll be covering a lot of that in today's session as well. A couple of tips for using HPOS. Sometimes you might be getting a system error when trying to log in through PRODA or HPOS, and that could be because of the link that you're using to access it. So keep that in mind. You try and use the direct link, which is proda.humanservices.gov.au, in order to get onto your PRODA account and log into HPOS. Note that after 30 minutes of inactivity, you will be locked out for security purposes and you'll need to sign back in. So just keep that in mind when using the system. And also we've noted that oftentimes there'll be issues if you're not on the latest version, or not the latest version, but you need to have a minimum browser version in order for PRODA and HPOS to function appropriately, and those are listed on the screen there for you. There's also a learning platform, an e-learning program that Services Australia have for using PRODA and HPOS if that's interesting to you. Okay, so what do you need if you're going to create a PRODA account? Now, we're talking to the RO right now, so the responsible officer is the person that will need to create a PRODA account in order to register the organisation, but any OMOs or anyone else supporting the organisation to manage their My Health record, so the other OMOs in the organisation will also be creating PRODA accounts once they are ready to start supporting the organisation. But in the first instance, it will need to be the responsible officer who is creating, who has a PRODA account in order to get that HPIO. And what can then happen is once that RO has registered the organisation, they can nominate OMOs to then log in through their own personal PRODA accounts to start managing the system. So anyone creating a PRODA account will need to have 3 forms of government issued ID. If the user's name does not match on the 3 forms of document, then they may also have to provide a change of name certificate or a marriage certificate. And we recommend using a driver's license, passport, and Medicare card, because those 3 forms of ID have known to be validated the most frequently in the system and caused less issues for people creating PRODA accounts. This is a personal account, so anyone can create a PRODA account, whether they're administrative or clinical, and it is personal to them. So they need to put in their personal phone number and email address for 2-factor authentication, and this should not be shared email or shared with like a business email. It needs to be personal because this is your own individual PRODA account. Moving to the next slide. Thanks, Kathy. So here we can see that there are 3 key steps for creating a PRODA account. I won't go into this into too much detail because it is really easy to navigate on the PRODA website, but essentially you can see that the user will need to enter their personal details. They'll then verify their 3 forms of ID, and then once they've done that, they can link to existing services. Now, if the user is a AHPRA registered clinician, they can also link their AHPRA registration number in there and become linked as a clinician. And we'll talk about that in a moment when we talk about HPOS. So here is a list of some of those forms of ID. A quick note to say, if you don't have 3 pieces of ID from this list, there is a manual verification form that you can use as a alternate option. Now you should get this pop-up or this confirmation screen once you have successfully verified your 3 forms of ID, and that will be the start of your PRODA account. So now the next step is linking to any existing healthcare identifiers that you may have. Now, not everybody has a healthcare identifier, so if you're an administrator, you might not have a healthcare identifier just yet, but if you are a clinician, you can link your AHPRA number by clicking on the Link Identifiers button within the HPOS tile. It will ask you for your AHPRA number if you have one. Another form of identifier that you might also link is if you are an OMO who has been nominated by your organization's responsible officer previously. So you'll see in a moment when we go through the application process, the responsible officer can nominate OMOs. So if that has happened and you have been nominated as an OMO throughout the application process, then you will have been issued with a identifier number that identifies you as an OMO for the organization. So you can also link that in here by clicking on Link Identifiers, enter in your OMO number that you were sent, and that will link you to the organization, and you will have that functionality available to you in HPOS. Now, the functionality available in HPOS will be different depending on how you are linked to the organization. So there will be different services or functionality available for clinicians, but there is standard administrative functions available for anyone linked to the organization in HPOS if they are non-clinical as well. So here you can see an example of where you can enter in your identifier. For healthcare professionals, it will ask you if you have an AHPRA medical registration number, click yes and then enter that in. For administrators, you can click on no, and then you can enter in your information, and that will establish a step for you in order to connect through to the HPOS for your organization. So as I mentioned here, if you are an OMO, you'll click on yes. It will ask you for your OMO number. Entering that in will then link you through to the organization as the OMO. However, if you don't have any identifiers, you can skip this step and come back to it at a later date. Also, searching for identifiers is an option there as well if you don't have your AHPRA number on you. So the final thing that HPOS will ask you to do when you go to access it for the first time is set up your mail center notification settings. And just a tip here, always a good idea to select immediate notification for each new correspondence, because when you go to register the organization, you want to know as soon as your HPIO number is available so you can progress that. So rather than having to actively go in and check, you want to be notified of when there is a new correspondence sitting in your HPOS. So set that up here to help out later on in the process. So now we can see we've linked our OMO number or our healthcare identifier, and HPOS is now sitting in my linked services. So we can just click on Go to Service to access HPOS. So let's look at the process for the RO to register the seed organization. So here we can see we're up to step 2. We've gained access through HPOS, and many of you may already be up to this spot. So this is where you would start the process. So information required for the RO to register the organisation. They will need to have the Australian business number, or the ABN or the ACN for the organisation. If the RO is a clinician, have the APRA number if available. And they'll need to also prepare one of the following documents, and this documentation is required in order to prove to Services Australia that the RO has legal authority to act on behalf of the organisation. So this proof of relationship to the organisation is often required if the RO is not linked to the Australian business register for that organisation. So there's a range of documents listed here. We won't go through all of them, but the one that I want to highlight is the one at the end, which is the current company extract from ASIC. We find, especially if organisations are existing as a trust, that the current company extract downloaded from ASIC can often be a document that is verified quicker than some of the others. So as long as the responsible officer is listed on the current company extract from ASIC, then that will be proof of relationship to the organisation, and the HI service will be satisfied that this person does have the authority to register this organisation with the HI service. Here we can see that there's backup options if the RO is not listed on any of those verifying documents. There are a couple of ways to apply other documents, including a stat deck. But again, if you're having issues with establishing the RO or preparing documentation to prove the relationship, then we recommend reaching out to the HPOS team at Services Australia, who can help with your specific scenario. So the RO logs in through their PRODA account. Their PRODA account has already been linked to the organisation, so they'll log in through PRODA. Then they will select HPOS from the available services, and then they will select the My Programs tile. Once they've gotten into My Programs, there'll be a tile that says Healthcare Identifiers and My Health Record. That's the one we want. And then Register Seed Organisation. Now, don't get confused between the two tiles that sit next to each other. One says Register Organisation and the other says Register Seed Organisation. Make sure you're selecting the Seed Organisation, because this is the first part of the process, as we covered earlier. Now, as we mentioned, the RO needs to enter in the ABN or the ACN for the organisation into the apply section. Once you're on Register Seed Organisation, it will ask you for the ACN and the ABN. Once you've entered that in, you click on Apply Now. Then you will see a 3 or 4 tab form populate into HPOS. Fill out the form as usual. You'll see the first tab is asking for organisation details. Some of the information may be pre-populated, but what's really important for you to enter in as an RO is the trading name and the organisation type. So the trading name is how your organisation will be known in the My Health Record system. If your organisation has a different name on the Australian Business Register that is not easily understood by other healthcare providers or by consumers, that may be something to consider. So enter in your trading name and then select the correct organisation type. So here we can see that there is a bit of a drop down there, and we've provided a list, or Services Australia rather have provided a list on their website of all the organisation types and when it's appropriate to use it. So click on the link to follow that to see all the organisation types and the subtypes to work out what might be best suited to your organization. But a tip for hospitals, particularly the sort of specialist day surgeries, make sure you select one of the hospital organization types rather than selecting, for example, the type that says specialist organization, because that will sort of look a little bit different when it comes to the data and reporting, and it may affect what is written on the uploads for your organization as well. So select the right organization from the beginning, and that will help with the management of the process throughout. So once you've completed all the details in the organization details tab, the next tab will be the RO details. So that's you as the RO completing this form. Again, some of the information may be pre-populated, and you'll need to put in your personal information here. It's important to not use auto-populate in these fields in case that causes any errors or the wrong information's in there, which will only just delay your application approval process. So manually enter and check all the information. Clicking on the next button will take you through to the next tab, but avoid clicking on that submit button until you're ready. So just clicking next to move on to your OMO tab. So this is where the RO can nominate any OMO for the organization, and we highly recommend that you do this in this step because the OMO will then be sent a notification that they have been assigned as the OMO for the organization, and they will receive their OMO number, and they can use that to link themselves when they create their PRODA account, and that will allow them to manage HPOS much easier for the organization. So we recommend at least adding one additional OMO in this section here. However, this is an optional tab. So clicking on next will take us through to the final tab of the form. This tab may not populate. So if the RO's details have already been linked to information on the Australian Business Register through the HI service verification process, then this document tab may not populate. So that means you'll only need to finish at the OMO details and then submit. But for many organizations, the document tab does populate, which means you'll need to provide that proof of relationship. So what you'll do is with the proof of relationship document that you have prepared earlier, you will find the type in the drop down, click on choose file, and then upload that file. Once you see that the file is uploaded, then you can click on submit to move on to review your application. Ensuring that you review your application. Now, this is where some people get stuck because they click on submit and then they might think, oh, application's done, or they walk away, or they get start doing other tasks. But it's important to note that your application is not completed after you click submit. You need to do one more thing. So here you can see that there is an overview of the information you've provided in your application. You can see here that there are a range of details to check. Moving to the next slide, you'll also see that there are acknowledgement and declarations. So this will ensure that you are acknowledging that you will comply with the My Health Record legislation and that your organisation will be using My Health Record as per the participation obligation. So reading through the acknowledgement and selecting each of the tick boxes. Moving to the next slide, you'll see the final tick boxes listed there. And these tick boxes will cover off on things like we have a policy in place, we acknowledge our obligations, and we will report any data breaches and so on. But have a read through those, tick all of those, select the final declaration, and then once you've selected all the tick boxes, you'll see that the confirm button becomes active. And then you can click on the confirm button. So it's not until you've done this that your application will be submitted. So you have to make sure that you select the confirm button, and then you will get a green alert at the top of your screen that says success, your application has been submitted. So we can see the status of the application and the application ID. We recommend that the RO takes note of that application ID number in case you do need to contact Services Australia for support at any time. If there's anything that holds up your approval, contacting them using your application ID will save you a lot of time. And what we're seeing here is a status pending, but what you'll also see within 24 hours, hopefully for the majority of people, will be an approval. So that status will change to approved. And here you can see we've logged into our HPOS mail center, and you can find the mail center under the messages section of your HPOS. And we can see here that we've got a notice of the application being approved. We recommend also opening up that notice and downloading it into your local computer system and saving that so that you can refer back to it. This application is going to contain your unique HPIO number for your seed organization that has just been registered with My Health Record and the HI service. So we've seen how to register a seed organisation. It's a very simple form, and if you come prepared, it can be very quick and easy to complete that form. And then within 24 hours, in most cases, we'll receive that approval. So the next step will be working out the structure. So if you know your structure already, you can go straight ahead and add in your network organizations. However, if your organization is a seed only, then you won't need to worry about this step. But for those of you who think you may need to be adding network organizations into your structure, it's quite simple to do it. So I'll show you just an overview of the steps rather than going through it one by one, but it's all listed on the slide in the next part. But we can see here it's the same Healthcare Identifiers My Health Record tile, but this time you're going to click on Manage Existing Records, and by doing that you'll be able to select the seed organization and then start adding networks that sit underneath that seed. So in the next slide, we've got a full list of each of the clicks that you need to make in order to register your network organization. Now, it's important to note that registering your network organization in HPOS or adding them as a network organization under a seed does not automatically give that network access to My Health Record. So you'll need to do it in two steps. The first step will be adding in all of your network organizations, and you can see that listed in step 1. And then the second part will actually be going in and registering those organizations to My Health Record, and you can see that in step 2 here. So you don't need to go through a whole registration process for each of them. The only thing that is really required when you register network organizations is to tick box which organizations you want to have access to My Health Record and then select whether or not they have an access flag. So if you think that those network organizations should have an access flag, then you can set them up at the time that you register them here. So it's very quick and easy to add your network organizations to My Health Record by going ahead and doing this process and selecting your access flags. Again, if you want more support on this, please have a look at the website. So here we can see the next step. So we're up to part 3. So in the next slide, I think we've got an overview of where we're at. So we've registered our seed organization and any associated networks if relevant. And now we just need to set up that secure communication with the digital platforms and with the HI service. So that is the purpose of step 3. We can see that there's 2 options here, either a NASH certificate or a CSP linking process, and we'll go through that now. So let's start with requesting and downloading a NASH certificate, because this is how the majority of organizations will be communicating with the HI service and those digital tools. So what is a NASH? For those of you who aren't aware, it stands for National Authentication Service for Health. And essentially it is a secure way to share health information with your digital tools. So it's not only My Health Record, but having a NASH certificate will also ensure that secure connection through to other tools like electronic prescribing, secure messaging. And it is important because without the NASH certificate, we won't be able to receive and share that secure health data for using the system. So the NASH certificate needs to be in place prior to using the system. The NASH certificate lasts for 2 years, and it can be requested through HPOS, which we'll go through in just a moment. Now, the only exception for a NASH certificate is if you are using a specific software product that does not use NASH. So that is a contracted service provider, or we refer to them as a CSP. So there are a few examples of contracted service provider, which I think we'll be sharing in the next couple of slides. But if you're unsure whether or not your organization needs a NASH, then reach out to your software vendor and they will let you know. But most software products do require a NASH to connect through, but there are a small handful that have done the NASH essentially for you, which means you just need to link to that contracted service provider in HPOS. So that's sort of the exception to the rule, but for the most part, let's have a look at the NASH process. So again, just to give you a visual overview of how the NASH PKI, it's also known as a NASH PKI site certificate, but essentially it unlocks access to these digital health tools from our organization. So the first thing that we need to do again is check with our software vendor if we need a NASH certificate. Here are some examples of software products that don't require a NASH. These organizations can skip this part and go straight to the CSP linking part because the software vendor that they use has done the NASH authentication for them. So basically that means that your software product is already securely connecting through to My Health Record, but it just means that you need to link your organization with that software product in HPOS. So you need to let Services Australia know in HPOS that you're using a CSP. But for everyone else, we need to establish that connection between our software product and the digital tool that we're using. So we won't go into NASH into too much detail. Again, it's a very simple process. It takes 10 or 15 minutes to log into HPOS and request a NASH certificate, and there is downloadable step-by-step instructions on the NASH website as well for you. I'll go through this really quickly, but in HPOS, you will find a certificates tab. In the certificates tab, you'll be able to find a link that says request a NASH PKI site certificate, and you'll be able to open up the form for requesting a NASH certificate for your organization. There's the link. We'll click on that and we'll be able to start the process. Now it's a single form and it only has a few fields. The important thing is that you must have your software product name and version number in order to complete this form. So make sure that you know what version number your software product is, because that will make a difference when it comes to the type of NASH certificate that will work in your software product. So make sure you are aware of that when you start. Enter in your software product, and then it will ask you for a mobile number and a couple of acknowledgements, and then that's essentially the entirety of the form. So the important thing with the mobile number is to make sure that the mobile number will be the person at the organization who will be available at the time that the NASH certificate will be ready to be downloaded and installed. The mobile number provided in this form will be sent a code, a PIC code, which will contain specific digits which you need in order to unlock and install that NASH certificate when it comes time to installing it. So just be wary of that when it comes to the mobile number that you provide in the form. So this screen is just showing you an example of searching for a specific software product. Start typing the name in and you'll see that the drop-down list will show you some products. Make sure, again, you're selecting the right version. If you can't find your software product or version on this list, then it's important for you to contact your software vendor to discuss this. You may need to upgrade to a later version, or the software vendor may have other advice. So reach out to your software vendor if your software product is not on the list. Here we can see the completed form, and we're going to click on Save Changes. So that's all it takes. So now we can see that there is a review, so we can see the information that we've provided. We can see that there is, again, same deal here, some privacy notes, declarations. If you're happy with everything that you've read, then click on Submit. Some people might need to scroll down to find that Submit button. But here we can see in the Certificates tab, we now can see the certificate that has been added in here. If the certificate takes longer than 1 hour, then that is not the usual time frame. Usually it can take anywhere from about 15 minutes up to an hour, but at the very most, 1 business day. If after 1 business day, you still haven't had your NASH certificate pop up into the Certificates tab here, then contact the NASH helpline, which we'll provide later on, to find out what's going on. But for majority of people, once you submit and you wait about an hour, the person whose mobile number was added into the form will receive a text message to notify you that the NASH certificate is ready for download. Now you have 30 days to download your active NASH certificate before that download link will be removed, and that certificate will stay active for 2 years. Use your PIC code when it comes time to installing the NASH certificate, and if you're unsure how to install your NASH certificate, reach out to your IT or your software vendor for support, because in most cases they can certainly help you in installing that NASH certificate into your software product, and you'll need to provide them with that PIC number as well. So now the NASH certificate is installed and you've got that two-way connection through to your digital platforms, and you can proceed with the final configuration steps. For those of you who are using a software product that does not require NASH, I'll just show you where you can get more information about the CSP linking process. But essentially, there's a specific couple of spots within HPOS where you'll need to enter the CSP number for the organization that is providing your software product to you. So let's use Genie, for example. Genie Solutions has a unique 16-digit CSP number. You'll need to obtain that from Genie. It is available on their website. And if you use another software product, you may need to contact the software vendor to retrieve that. And then you're going to enter it into 2 places in HPOS. The first place you're going to enter it into is through the organization snapshot. So right next to that certificates tab that we were looking at before, there is a tab called CSP links. So you'll copy and paste that into there and then create that link through from your organization to that software vendor. And the second place that you need to enter that is in the My Health Record organization registration spot, which is out on your My Programs tile. So again, there is a guide at the bottom of the screen here that you can absolutely access to help you with that, but it does take about 5 minutes to paste that into the appropriate areas into HPOS, and that way the HI system is aware of your organization using this software product for access to My Health Record, and you can proceed with the connection, the final configuration steps. So the final configuration steps I'll go through pretty quickly. I'm conscious of time and I want to make sure we get to everybody's questions. So sorry, bear with me, Kathy. I'm gonna try and speed through this section. But this is really straightforward. The last step that we need to do is bring everything together and make sure that all of the healthcare identifiers are configured correctly in the system. Make sure that our system is set up appropriately. So our NASH has been installed and everything is all set up, ready to go and ready to access My Health Record. So you'll need to obtain the HPIIs, which, as Kathy mentioned earlier, are those individual identifiers for healthcare providers. So on the next screen, I think we've got some information on HPIIs. Yes, we do. So there are a couple of ways to find the HPII numbers for your clinicians. If you are a larger organization and it's not feasible to have clinicians send you their ARPA numbers or their HPII numbers, then there are a couple of other ways to view it. So there is a HPII a search function in HPOS. So if an OMO is logged into HPOS, they can enter in the details of all their clinicians to obtain the HPII numbers. You'll need a HPII number that is linked to the ARPA registration of each clinician, and enter that into your software product in order to ensure that that clinician has access to My Health Record. Now, if you have any non-ARPA registered health providers that want access to My Health Record as a clinician, so some allied health self-regulated bodies, then there is a way for those individuals to request a HPII number through the HPOS system. Again, all of that about obtaining HPIIs is linked here on the slide. But once you've collected all the HPIIs for your organization, you provide that to either your IT support or the person that is going to be configuring that into the system. They will enter those correctly into your software. Now, each software's configuration requirements will differ depending on the software itself. So the way your software saves HPIIs will be different from somebody else's. So that's why we recommend having all of those HPIIs ready, have your NASH certificate ready for installation, and then contact your IT support or software vendor to install and configure that all in the software product. Once it's all installed and configured, then you should have access to My Health Record. So we've got some useful resources and contact information, and I'll hand over to
Sorry,
you,
Bree.
Kathy, to cover that.
Just before we go into that, I thought I'd just check for a couple of questions first.
Sure.
Actually, maybe I'll go through the resources first and then we'll get to the questions. That might work better. I'll just
Cool.
quickly go through those. So once you have got through that process, there's a couple of useful pointers. As I mentioned at the beginning, the agency have a number of teams that can support you through that registration process, but we also have an education team available to help you train your staff. So if you want to contact our education team and organise a session for your staff, you can reach out to us through that email address, education@digitalhealth.gov.au. And then we'll get in touch. We do have existing training resources also available on our website. We do run regular sessions which demo using this My Health Record through different software systems, which you can find through that link. We also have some YouTube recordings of previous webinars. We also have some free e-learning modules, which are fantastic and self-paced learning, and they also give staff the opportunity to then have proof that they've completed that e-learning. And we have some simulators of some of the software where we can demo that as well. So there's a whole range of different ways that staff can be trained, but we can support you in that space if you want. The other thing that, of course, you can refer to are the manuals from your software vendor. They'll often have a section specifically around My Health Record and its use within their system. In terms of some additional useful contacts, aside from those that have been linked throughout this whole presentation, there are a few other links that can support you through your organisation's process in terms of managing your NASH certificates or your Medicare PKI certificates. There's a couple of links there. If you want to add an additional OMO to your organisation, then we've linked the steps that are on these hyperlinks here. And if, as Bree mentioned earlier, if you've already got that HPIO number, so your organisation's already been registered, but the person who did that registration has left, then you can replace or complete the form to update the details and have a new responsible officer put in place. So that's a hyperlink to that, directly to that form. And if you have a change in ownership of the business, then there are steps linked on that hyperlink as well. In terms of getting through that whole process, if you need help along the way, there's a number of help desks that you can contact as well. If you get stuck with getting actually that set up to use the PRODA account, you can call their help desk. If you get lost with HPOS, there's a help desk for them. We also have the Healthcare Identifier service help desk, which can give you guidance around the identifiers needed for your organisation and that HPIO number. And there was also the e-business service centre, as well as the agency's connections assistance team, which we have Jess on the line with us today. Thanks, Jess, for joining. And if you contact through that email address or call the number, then Jess or the team will guide you through that registration process and help you out and point you in the right direction if you need to contact any of those other services. So now I will pause for questions and see what we have. I saw a few had popped up, so I might ask Ashley for you to unmute your microphone, because we've got a couple of questions that relate to the national standards. So the person who asked previously about having the not having conformance software and using the provider portal has then followed up and asked, so is it compulsory for us to upload? If we're using the provider portal, we can't do that. We'd only be viewing. So Ash, what would you say in response to that?
Thanks, Kathy. It definitely is worth, I guess, having that conversation with the Commission. It will depend as well, from our understanding with our conversations with them, it'll depend on what your organisation has actually included in your detailed plan that you may have submitted to them in the last 12 months or so. So it's definitely worth having a conversation with them to double check. I do know that I believe it's in Actions 118 that it does use the words contribute to the My Health record, which you would sort of expect that's an upload. But if you don't have the software to do that, and there's limitations within your organisation, again, that's something that you want to, I guess, speak to the Commission about, so that you can discuss about what's going to go in your plan and what steps you need to take, if any.
Yeah. So there's some other questions relating to that same sort of process in terms of, you know, is it a requirement to upload a discharge summary? And I guess ultimately we would like you all to be connected and able to view the information and upload and contribute information. But as Ash pointed out, it's dependent on what you've detailed in the plan and where that's at in terms of your implementation process. Thanks,
That's right.
Ash.
And Kathy, just on that as well, you know, when we have spoken to the Commission and asked, you know, if it's specifically a discharge summary, they haven't dictated that it is a discharge summary. So I think it is really dependent on what document type is relevant to your organisation. So I guess looking at, you know, who your audience is, who your providers are that you would send information to, but also your patients and the type of services that your hospital or day surgery might provide, and then deciding then what document type that is. So they haven't specifically prescribed discharge summaries, so that's also something worth looking into as well.
Thanks, Ash. So this might be another question. Well, actually, Bree, this might be one more suitable for you. So the question relates to that uploading of documents and whether there's the ability for staff who do not have an HPII number to upload documents to My Health Record. So for instance, a ward clerk uploading a discharge summary. Actually, maybe Ash, you might be able to also chime in here. Bree, would you like to go first?
Yeah, I'll give it a crack, and then of course, Ash, please jump in. But My understanding of this is that it comes down to the way that your policies and procedures are set up in your organization, and also what your software functionality will allow you to do. So some softwares are set up where, unless it's a clinician login, the My Health record won't be available, and that might be design from the organization, or that might be just the software. And then also your policies and procedures will help you determine this for your organizations. In some cases, if it is appropriate use for your organization to allow uploading of documents and access to My Health record from non-clinical staff, that might be stipulated in your policy around ensuring that you're complying with the legal obligations for doing that. However, I would recommend having a chat to the agency's partnership team if you're not 100% sure about setting up access for specific groups in your organization, because they've been pretty helpful in the past. And every healthcare organization's scenarios are a little bit different. But I'll throw to you, Ash, if you want to add to that.
Yeah, I think you've captured it pretty well. So nothing to add, actually.
I was just going to chime in with the example of, I know that for specialist practices, that they've been able to have staff authorised to access and view the system as long as it's spelt out in their policy, so that their practice manager, for instance, if they are authorised, can collate the information for the clinician without the clinician having to click on the button necessarily. It depends how, again, the software's set up. But in terms of uploading of information, again, that the document that is authorised has to get signed off by the clinician, but the practice manager can do the final clicking and sending, if you like. But that's kind of that specific scenario around specialist letters. Moving on to the next question, Bree, this might be one for you to answer. If there are two organisations with a separate ABN, so one each, but the same governance, can you link the two with the same access, or do they need to have a seed company?
It's a super interesting question, Kathy, and I think I might actually throw to Jess to see if she can provide some insight around this in her experience supporting organisations.
Yeah, so with this one, it is a bit hard to answer straight off the bat. It is a case-by-case basis with this one. It depends on how the practice is set up and how it's running. You could set it up both ways. So I'd suggest contacting us at Connections, and we can actually have a chat with you with how the practice is actually set up, how you guys are running, and whether it's best to go by a seed organisation or whether it's go down the network route.
It's Ashley here too, and I'll just add to that as well, just I guess to give participants on the call a bit of an assurance that we have seen this situation quite a bit, especially in the hospital space, particularly if you have more than just hospitals within your brand. So you might have community health or aged care, all operating under sort of different brands. And so we would typically have a seed network structure in that case. But in terms of how we set that up, as Jess mentioned, it's always good, I guess, to sort of map it out on paper, and then we can have a chat with the agency to work out sort of what that looks like in terms of the practicalities of doing that within HPOS.
Great, thanks, Ash. There's been a few specific questions coming through for organisations, and we'll actually get someone to contact you about those specific nitty-gritty questions as well. So for those of you who've posted some of those, we'll get someone get in contact. We also do have a little questionnaire that'll pop up at the end of this session, so if you want support there is a question about that, you can say yes please, and then we'll get someone from the team to get in touch with you. And just to point out, I think there's also a question, is will the video of this session be made available? Yes, it certainly will. Along with the slides, we'll send you a link to the recording, so you can watch this back at your leisure later. It will be sent to everyone who registered, whether they've been able to stay on for the session or not. Another question, this might be one again for you, Ash. Why do I need to get HPII numbers? Is this only for those who will access my health record?
It's a good question. I don't know if we covered it at the beginning. We may have covered it in the slides, but that HPII number is one of the, I guess, the holy trinity of numbers. So we need the HPIO, which is our identifier for the organisation. We need obviously the patient's individual healthcare identifier, and then we need the provider's HPII in order for us to use the My Health Record system. It depends on, again, case by case, depends on the product that you're using and how that's actually set up within the product. So it's definitely worth having a chat to your vendor in terms of, do they have a lookup for HPIIs, or do they, do you have to, manually record that into the product? It's typically for viewing, believe in Kathy, Bree, jump in if I get this wrong, but I believe for viewing, you don't need to have the HPII in some products, but you do need it when you're uploading a document.
So generally, you will need an HPII generally for your clinicians to be able to use the system. So unless the software has a workaround, but most of them will need that HPII number. As Ash said, it's one of the holy trinity of numbers, as we covered earlier in the session. Yeah. There's another bit more of a detailed question, but I think this relates to HPOS. So Bree, I might throw this one to you. What if under HPOS, my programs, there is not a box for healthcare identifiers / my healthcare record, my health record, sorry. Bree, are you able to?
Yeah, I'll have a crack at it, and then I might ask Jess to chime in if she's got any additional advice on this. But from my understanding, if you're not seeing healthcare identifiers in My Health Record, then you haven't been linked to the organisation in HPOS. So you haven't done that step where you've got an OMO number and you've added that in and linked yourself to the organisation, and it may just require you to ensure that you are linked to that organisation as an OMO first in order to get that functionality. But Jess, is there anything else that could cause that?
Yeah, actually, so going to healthcare identifiers in My Health Record is the step before actually registering for a HPIO or registering an OMO. So if you're not actually seeing the healthcare identifiers in My Health Record option, it normally means that when you've selected HPOS, you're selected to act as the practice instead of acting as yourself. If you're acting as yourself as an individual, then you'll see it. But yeah, normally if you don't see it, it's because you're acting as the practice and you have different options there. You normally have a lot more limited options.
Yeah, that's
Thanks,
a really
Jess.
good point, Jess. Thanks for that. Just to reiterate, when you go into your HPOS through PRODA, it will ask you if you want to act as an individual or act as the organisation, and always choose individual when dealing with My Health Record. So anything else that you're doing in there, whether it's registering your organisation, doing certificates or anything like that, always acting as an individual will then identify you as the OMO. So that's a great point. Thanks, Jess.
There's another really good question here, which I might throw to myself. This is when we're submitting data, should patients be given the option to opt in or out of My Health Record? That's a really good point. The main thing is to be aware that individuals have already had the option to choose whether or not to have a My Health record. So some people may not have one at all. They might have opted out. Many people have been waiting and seeing and have since opted back in, interestingly. But also then if you are uploading information, then a patient does have the right to ask that that information not be added to their My Health record, and you must comply with that request. So if you have a software set up, it will have the option to check a box to say, do not send this discharge summary to My Health record. So yes, you will need to have that in place, and that's part of the requirements of setting up for the system. I'm just really conscious of the time. I know we've got a couple more questions. If anyone needs to drop off, we completely understand. We might take the rest of the questions on notice and get back to those individually for those people who've posted those questions. So I apologise if we haven't got to your question today. There's quite a few flowing in to the question pane, but I'd just like to finish off by thanking everyone for joining, thanking our panelists, and in particular Bree for the presentation. And here are some contacts if you need to get in touch. As Jess pointed out, they're available to support. If you contact via this email address, it will find its way to the relevant team within the agency, and we'll be able to get in touch with you and provide that follow-up support. Thank you very much for joining, and we will follow up with those additional questions after the session. And please complete the little survey that'll pop up on your screen at the end. Thanks everyone. Enjoy the rest of your day.